Hello, everyone. My name is Donnae Ward. I am the Health Equity Coordinator for Advanced Community Health and the host for our new podcast, It's Giving Health. This podcast is going to dive into deep topics to talk about health of all the things that impact our community. For this week, we are talking about Black Maternal Health. So Black Maternal Health Week was founded by the Black Mamas Matter Alliance, and it is an organization that really looks at the health disparities of Black mothers and birthing people. According to the CDC, the rate of Black women who died in childbirth was 3.5 times higher than that of white women. So this week really emphasizes the power of the organizations that are working to change these numbers. Here with me is Brenda Gartrell, nurse practitioner of Advanced Community Health. Brenda, thank you and welcome.
Thank you for having me, Donnae.
Yes. So Brenda, please tell us about yourself, how you got into the practice, how long you've been practicing, and what made you interested in women's health?
Well, I've been with Advanced now since 2024, last year. I work as a nurse practitioner in their OBGYN department. In regards to why I'm interested in maternal health, previously I used to work inpatient in the hospital caring for laboring women, so women in labor. Okay. And in regards to what I saw, a lot of those women realized that they felt like they weren't being heard or listened to. Mm-hmm. And I felt that, there would be additional providers that could do that job. I could do it too. So I decided to go back to school and get my master's. And with that being said, I feel that I've been able to bond with my patients and it's been a worthwhile experience.
Okay. All right. So then let's dive right in because you did say something and we're going to come back to that. But so Black women in the U.S. died at nearly 3.5 times a higher rate than white women, which I mentioned. This was from 2023. Overall, racial gaps actually widen, especially due to the pandemic. So what is significant is that the maternal death rate for white women, Hispanic women, and Asian Americans actually lowered, but Black women are still dying. So what have you seen in your experience regarding Black maternal health, and what barriers are Black women facing?
Yeah, you brought up really great points, Donnae. So as of right now, in the state of North Carolina, Black women make up about 22% of the population, okay, but they account for about 43% of the pregnancy-related deaths. So what I've seen in my practice thus far is that some of those women feel that they're not being listened to in regards to concerns that they may be having. Mm-hmm. They may feel that they're not getting adequate support, whether it be from their healthcare provider or their family. And then some of them are ending up with health conditions that are preventable. Mm-hmm. So with all of that being said, in my practice, we try to educate, especially our birthing patients, about things to look out for in regards to concerns related to pregnancy. And then we also try to work with the community to see which programs can assist them during their pregnancy, whether it's looking for assistance with work or looking for assistance with bill payment. So we try to create a community for them where they otherwise may not have one.
Okay. So what I have looked up, which blew my mind, is that the data shows regardless of education and socioeconomic status that Black women are still dying at an alarming rate. What are your thoughts on this?
Yes. So regardless if you have a bachelor's degree, a high school degree, a master's degree, all of those factors do not improve the numbers, if that makes sense. So then we have to start looking at where is the barrier in regards to providers? Are providers not listening? Do patients not know what to look for? So in our program and Advance, we help our patients to be able to advocate for themselves, to know what to look out for, and then what is normal for them, for their bodies as well.
Okay. So speaking of, the 2025 Black Maternal Health Week theme is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy, which I love. I even love that they talked about their values of shifting the culture and policy change and everything, right? So, but speaking of collective action or just advancing, Advanced Community Health did launch the OBGYN program, yay, so tell us about a little bit more about how this program is combating these health disparities.
Yeah, so our program is centering in pregnancy, and what centering is essentially, it's group prenatal care. So our patients all start off after their first ultrasound. We confirm that they're pregnant, that it's a viable pregnancy. From there, we then have a model where they meet about every 4 weeks, and then we increase the interval based on how far along they are in pregnancy.
Okay.
And they not only get, their one-on-one individual care in regards to, how are they doing and, baby's well-being, but in that process, we teach them how to check their own blood pressure. We teach them how to check their weight. And then during the visits, there are several topics that we discuss that may either affect their pregnancy, or sometimes they bring topics to us. So whether that may be, navigating relationships, the transition from being a single woman to being a mother. So a lot of the conversations that we have in centering aren't necessarily just focused on, high blood pressure and diabetes, although that is incorporated into our conversations. Right. So one way that we are combating, the data shows centering helps to decrease preterm labor. Okay. It helps increase breastfeeding rates. It helps to space out pregnancies, so longer intervals between pregnancies. And also it helps in regards to overall satisfaction, because in those centering groups, we let our patients take the lead. So they're the ones helping to foster that conversation. It's not a didactic classroom where we're teaching and saying, this is diabetes and this is high blood pressure and this is what you need to do. It's more of, what have you heard about it and how can we work on it for ourselves individually, and what outcomes have you seen from your other relatives that may have, worked on their weight, et cetera, or may not have.
So centering does sound more of like a holistic approach, which is, I think of centering, that's the yogi inside of me thinking about centering. So I love that. Yes. And I don't know if y'all can see her earrings, her Black mama earrings, which brings me to my next question. As a Black mother, I'm a Black mother as well. What is something that you want other Black mothers to know in terms of advocating for themselves, or even just building a support system or a community?
I would say first, your body best. And if for any reason you feel something is amiss, something feels uncomfortable, something is a concern, voice your concern. And if that person isn't listening to you, escalate it, find another provider, find another practice. Clearly your concerns are valid. There are clearly some things in pregnancy that are very normal, right? Just having back pain and maybe, feeling nauseated.
Heartburn.
Right. And then there's a point where if it's affecting your quality of life, if it's impeding you from being able to go to work, go to school, things of that nature, that's when we need to really advocate for ourselves. And not just ourselves. In our centering groups, we allow the partner or support person to come. That could be a mom, that could be a sister, that could be a boyfriend. So that person is also getting that additional information. And that person can also help, because sometimes you might forget things, right? So that person also can check in on you and say, hey, you're having a headache. Let's check your blood pressure with the machine that they gave you. Right. So I think that's part of it, being able to advocate for yourself. And if you're not able, encouraging the people around you to say, hey, this is not normal. She doesn't feel well. What can we do to help her? So I would say that would be the first place I would start off in that regard. As a woman that's been through the birthing experience, I advocated for myself, whether it was saying I'm having pain, I need this addressed, right? Or, I feel uncomfortable, I need help. And at times there's a narrative of, we need to be strong, we can't ask for help, we can do it on our own, our grandmothers did it, our sisters did it, why are you complaining? So I think that as well might impede some people, when their relative is saying, well, I was short of breath, I had 3 babies and my belly was huge, so it's fine, just drink some water. When instead something really is going amiss for that person, it's being missed in the process.
Yeah, because everybody is different, right? Yes. So Brenda, what have you seen in regards to your patient population at Advance?
Okay, that's a great question, Donnae. In regards to our patient population in advance, we take care of patients regardless of their ability to pay, whether that be self-pay patients, Medicaid patients, and private pay patients. And it's amazing because Medicaid actually covers 4 out of 10 births. And with Medicaid now expanding, it helps to decrease the issues with pregnancy-related deaths, because rather than just looking at a mom right after she has a baby and 6 weeks out, we're now looking at her health for a full year. So she's able to access primary care. So she's able to access different healthcare providers that otherwise she might not have been able to if she were only covered for the first 2 months or 3 months after having her baby. With that being said, finances in regards to our patient population, we know that can be difficult for some.
Right.
So we do incorporate some sessions with our other community partners to try to bring them in and bring awareness to our patients of the community organizations that are available to them and can provide them services as well. We do help with providing referrals for diapers, in addition to other resources that they may feel that they need. We also have a social worker in our clinic, and her role not only is to focus on the additional resources that patients may need in regards to finances and bills and housing, but she also helps to check in on their mental health. That is actually the leading cause of death in pregnancy-associated deaths. And it's important to note that as well, because at times our patients may not be aware of what baby blues mean, what postpartum depression look like. And they may think that, feeling moody during pregnancy is normal. But once they realize that they're unable to get out of bed or participate in activities or even take care of their other children, those are conversations that we're already having within our centering groups. How are you feeling? And, how are they coping with this new transition in their life? So we do have our social worker also join our groups to help lead that conversation and facilitate that discussion, because it's important. It is normal to have hormonal fluctuations, but if it's abnormal for you, we obviously have the support and resources to help those moms through those transitions as well. And then after they have the baby, checking in as well. A lot of the time, the attention goes straight to the baby, and the mom's mental health, her well-being may not be, at the forefront anymore. And all those partners that she may have had or, family members may be looking to help and assist with the baby, but not help her. So even if it's something as simple as encouraging our patients to tell them, incorporate your partners into not only the baby's care, but your care, and making sure that they're also looking for, are you having any signs of depression? Do you seem very withdrawn for your baby? Are you very anxious and not sleeping because you have underlying anxiety and not because the baby's waking up every 2 to 3 hours? So these are things that we discuss as well. In regards to our groups, although we focus in pregnancy, we also talk about postpartum care. Whether that's what's normal bleeding after having a baby, right? What are normal symptoms and aches and pains that you should expect, and what is abnormal for you?
So one thing that came to mind was the word support, right? And a lot of mothers out there might not know the resources available to them. Can you talk a little bit about what resources are out there and how they could utilize those?
Okay. Well, I would say, just speaking in general terms, in pregnancy, some women may seek the support of a doula. And a doula is supposed to be a birthing support person, and they can also help you postpartum. So this person can help you in preparing your body for birth. They can also help educate you on different things that you can do at home, exercises, lifestyle modifications to help during your pregnancy. And not only in pregnancy, they can also come and support you during your birth, which is the amazing part. So essentially, when you go into labor, or if you have to be induced, they would be present to not only help you through that process, but also help to advocate for you and say, hey, she wanted skin to skin, or hey, she wanted to have, her meal at this time, or she didn't want visitors. So she or he, your doula can be that support person and can also be the person that you need to essentially express any additional concerns that you may have, which is amazing. They tend to know you during your pregnancy if you look for them for that reason. However, they can also help you postpartum. So there are some doulas that can come and help you with not only your home, like just getting some things ready around the house, but can also help you with breastfeeding, making sure that you're feeling well in regards to your general Maternal Health. So it's amazing to have a doula, and some people benefit greatly from them. So if you're interested in doula services, that is something to consider. Aside from that, you can also look for a lactation consultant. Some people may look for a lactation consultant prior to their delivery if they had any issues, let's say with a previous baby in regards to breastfeeding or low milk supply. They may start seeking services sooner rather than later. In regards to a lactation consultant, generally after the baby is born, they come and make sure that baby can latch on to the breast and that you've established a good breastfeeding with your newborn, with your baby. So they can help in that regard as well. Some lactation consultants work independently, privately. Some pediatric and OBGYN offices do have them available on staff. So if that's also something important to you in your pregnancy or postpartum, that's also something that you can look into as well.
So one of the things that I thought about when I thought about my birthing experience is that the concern that I had going into the hospital thinking like, are there going to be nurses that look like me, right? So fortunately for me, I was really surprised that I had 3 Black nurses, and that actually gave me some ease. And I actually had a pretty good experience. I mean, I'm talking about as I'm going through contractions, we were talking about hair, right? So it was really like comfortable, really relatable. And then I also had a Black doula leading up to my labor and delivery. So, but then I think about it, and we talk about these health disparities, like what it is for other women who might not have the same experience, or do they have these same concerns, and what does that look like for them to have a good birthing experience? Can you talk a little bit about that, and even with your experience?
Yeah, you brought up a great point, and I'll set aside a plug. Some insurance companies do cover doulas. There some that will cover the cost.
Yes.
So if you feel that you would benefit from having them in your pregnancy or even after having the baby as well, postpartum, that's something also that you can look into as a client. So just throwing that out there. They do great work. But I will say in regards to my personal experience, I actually had good experiences with both of my births.
Okay.
I felt that the team that I was working with, that was working with me, they knew what I was looking for in regards of my birth. And my ultimate goal was healthy mom, healthy baby.
Right.
However we got to that point, I was flexible. With that being said, working on the other end as a healthcare provider, I try to make sure that my patients feel safe expressing themselves. They feel like they can come to me with things outside of their pregnancy, because obviously that will affect them in the end, whether it's losing a job, whether it's the end of a relationship. Because all of this as well is still going to affect your pregnancy, maybe not immediately, but it may affect you after the fact. So I would say in regards to what a good prenatal appointment or a pregnancy journey should look like, you should feel that whoever is working with you, whether it be your nurse, your OBGYN, your midwife, your doula, whoever is with you, is listening to your concerns. They are actually taking time to talk to you, to check in, that you feel that you have some type of bond with this person, right? That would be my optimal experience. But honestly, if you feel, like I've mentioned before, that you are not being listened to, that you are not being cared for in the manner that you need, then you need to find another place to be cared for. Because you should never feel as if you are less than. You should never feel as if in this most vulnerable time someone is taking advantage of you, because honestly it's not only a privilege, but it's a blessing in my regard, to take care of a person and have them feel the comfort to let them then say, you can take care of me. Because for some people that's really hard to say, I'm going to let you take care of me. I'm going to trust that you're going to make sure that I'm safe. I'm going to trust that you're going to tell me something's going wrong. I'm going to trust that you're going to give me the appropriate medications and we're not going to wait till the last minute, if that makes sense. So just going that extra mile, although it can be, time consuming and it might take a while for, things to work out within the healthcare system, I think is very important. And your appointment should feel like your concerns are being addressed, that any concern that you are having is either being not only addressed, but that you feel like you're an active change agent in your care. So you should feel involved within your care. And you should know that I too am involved in this process. You're not just doing something to me. We're working as a team.
Thank you.
What about you? What was your birth experience like?
Honestly, like I said, it was because I had a doula. I actually labored at home at first, so we were able to do that. And I didn't expect when I went to the hospital to have the representation. Sometimes it's just refreshing to see somebody that looks like you when you are in a vulnerable state. So it was actually a excellent experience. Yeah.
That's amazing.
Yeah,
That's
it
amazing.
really was. It really was.
Yeah. And I'll also say, when it comes to family members and partners, they should also be addressed, included in your visits. So it shouldn't be, okay, how are you doing? And your mom or your sister, your aunt sitting there and they're like, okay, well,
Right.
I'm just a fly on the wall here. They should be talking to that person as well, because that person knows, hey, she forgot to mention she was throwing up all day yesterday. Or, hey, I feel that she's getting a little down, maybe we should talk about that. Or they'll say, hey, she's doing great. I'm just here to be a support and.
And that is why having a doula made a difference for me, because that was my support system to have. She was definitely on it in terms of that. So, yeah.
Yeah.
Yes.
Yes.
So I really appreciate it. Thank you so much, Brenda. Thank you for your time, your expertise for this conversation. For our listeners, I hope that you kind of have more of an understanding of maternal health and a little bit more look into the health disparities that we're talking about. And if you are an expecting mother and need a healthcare home, Advance welcomes you with open arms. We have board certified OBGYNs, just a family feel and community. So we hope to see you. And I am Donnae.
I'm Brenda Gartrell.
And
It's Giving Health.